U.S., well, the new coronavirus appears to be causing sudden strokes in adults who are not terribly ill. Joining us now to talk more about this is Dr. Michael Curry, who is based in Vancouver and Delta. Good morning.
Good morning, Mary.
So let's talk about this. There's growing evidence that COVID-19 can cause blood clots, which can lead to a stroke. What do we know about these blood clots?
Well, we know that in coronavirus infections, there's more evidence that blood clots are a big cause of the problems associated with it. And there's been a recent report from New York of 5 relatively young people having strokes after being exposed to the coronavirus.
And these people only had mild symptoms or no symptoms at all. Have we had similar cases here in BC?
Not that I'm aware of personally, but it's been reported throughout the world that blood clots both in the lungs, in other parts of the body, and in the brain, when we call it a stroke, have been occurring with the coronavirus.
And is it common for young people to have a stroke?
Generally, no. Strokes are most common as people get older. So there's risks such as high blood pressure, smoking, that can make it a higher risk. But by and large, to have a stroke under age 50 is quite rare. That's why these findings from New York were quite striking.
We are learning new things about this virus every day. And these people who were affected, they were unwilling to call 911 because they heard hospitals were overwhelmed by coronavirus cases. What signs and symptoms should people be watching for?
So even though coronavirus is going on, the same things that would bring you to the emergency department in normal time should still bring you to the hospital. So for strokes, we're looking for numbness or weakness of your arms or your legs, facial paralysis or a facial droop, problem speaking, or a really sudden acute onset headache. All of those are signs that you could be having a stroke and should be seen by a physician.
And what is the best treatment for strokes?
So there's a lot of controversy about it. The best treatment is prevention. However, we're thinking in coronavirus infections, for those people that are in hospital and are very sick, there's more and more evidence of giving them blood thinner medicines that make your blood less likely to form clots may be of benefit in these patients. And that seems to be coming in as a standard treatment for coronavirus patients in hospital.
Very alarming. Do you see this happening here in BC and Canada at all?
Well, definitely. We still do have, thousands of cases of reported coronavirus in British Columbia. Most of them are mild, but we're still learning a lot about this virus, and it seems like strokes are one of the complications that can occur with coronavirus infection, and that's going to occur anywhere where you have a large number of people infected.
Oh, wow. Okay, well, thank you so much for bringing this to our attention, Dr. Curry. Have a great day, and hopefully we can talk to you soon.
Thank you.
All right, it is 7:52.